Have you ever seen someone give an injection that looked absolutely perfect, but they still made a serious mistake? The scary part is that this mistake is so common, most beginners don't even realize they're doing it. It can increase pain, reduce medication effectiveness, damage tissue, and even put patient safety at risk. If you're a nursing student, a new nurse, or learning injection techniques, this is something you need to know before giving your next injection. Most beginners believe the hardest part is inserting the needle. They focus on the angle, the syringe, and the medication. But the biggest mistake usually happens before the needle even touches the patient's skin. That mistake is failing to identify the correct injection site using proper anatomical landmarks. Instead of carefully locating the correct muscle, many beginners simply guess the location or inject where they have seen someone else inject before. This is dangerous because every patient's body is different. Age, muscle mass, body fat, and previous surgeries can all change the safest injection site. For example, when giving an intramuscular injection into the deltoid muscle, injecting too high may injure important nerves, while injecting too low may prevent the medication from reaching the thickest part of the muscle. Taking just a few extra seconds to identify the correct landmark can prevent serious complications. Another mistake beginners often make is cleaning the skin with alcohol and immediately inserting the needle. Alcohol needs time to air dry. Injecting while it's still wet can cause unnecessary burning and may reduce the effectiveness of skin disinfection. Simply clean the area, allow it to dry naturally, and avoid touching the site again before the injection. Injection speed is another overlooked detail. Many beginners push the medication too quickly because they think finishing faster means causing less pain. In reality, injecting medication too rapidly increases pressure inside the muscle and often makes the injection more painful. A slow, smooth injection is usually much more comfortable for the patient. Patient positioning also matters. A tense muscle makes the injection more difficult and painful. Encourage the patient to relax and place the muscle in a comfortable position before inserting the needle. Don't forget communication. Explaining what you're about to do helps reduce anxiety. A calm patient is much less likely to tense their muscles, making the procedure easier and safer. Finally, remember that your responsibility doesn't end when the needle comes out. Observe the patient for any immediate reactions, dispose of the needle safely, and document the medication.